Signs of autism. Some children have many early signs, whereas others have only a few. The number of signs autistic children have varies according to their age and the effect that autism has on their everyday lives. Sometimes early signs of autism change over time. For example, children might lose or stop using social communication or language skills. Or signs might become clearer as children get older. Social and communication development includes things like learning to smile, make eye contact, and use gestures. Be very interested in certain objects or activities and get upset if they can't do that activity. For example, watching the same TV show over and over. Behavior of autism. Autism is not a hardwired impairment programmed into a child's genes and destined to remain fixed forever. Paying attention differently to and recording the environment around and prior to the incidents can lead to an understanding of triggers for occurrences, like routines, order, and rituals. Has difficulty with change or transition from one activity to another. May be obsessed with a few or unusual activities, doing them repeatedly during the day. Plays with parts of toys instead of the whole toy. For example, spinning the wheels of a toy truck. May not cry if in pain or seem to have any fear. May be very sensitive or not sensitive at all to smells, sounds, lights, textures, and touch. May have unusual use of vision or gaze. Looks at objects from unusual angles. Sensory breaks can help your child regroup and refocus. Diagnosis of autism. There are currently no standard diagnostic criteria for adults with suspected autism, but they are in development. Diagnosing autism can be difficult because there is no medical test, like a blood test, to diagnose the disorder. Doctors look at the child's developmental history and behavior to make a diagnosis. Early diagnosis can make a huge difference in the lives of children with autism and their families. But it's not always easy to make an autism diagnosis. There's no lab test for it. So doctors rely on observing the behaviors of very young children and listening to the concerns of their parents.